Hello everyone, I'm Saika. Today I'm going to present a presentation that I conducted with regard to malnutrition, and I have tried to compare the status of malnutrition in Nepal with that of Australia. So moving on to the next page, I've got content, introduction to malnutrition, types and causes of malnutrition, condition of malnutrition in Nepal and Australia, impact of malnutrition on healthcare system, factors impacting health issues, statistic comparison and roles of nurses, conclusion and references. So moving on to the comparison, first I like to give a short review on what malnutrition actually is. Malnutrition is either the deficiency or the overconsumption of the nutrition like energy, protein, vitamins and other minerals, which impacts on overall development of our body. It can also cause various problems just like hinder development, vision problems, diabetes and other heart problems. So people can develop a specific type of malnutrition relying upon their environment, resources and their lifestyle. Moving on to the next page, type of malnutrition. So there are basically three types of malnutrition: undernutrition, malnutrition related to deficiency or because of more micronutrients, or overweight and obesity. So it is the types given by WHO in 2018. Undernutrition, wasting, stunning and the underweight. It includes wasting, stunning and underweight. Wasting refers to low weight for height, stunning is low height for age, and underweight is low height for age. Malnutrition related to malnutrition related to micronutrients. It includes either lack of malnutrients, for example, cobalt, copper, zinc, or the excessive amount of the micronutrients in our body. Overweight and obesity. It is of course related with the diet and things. It can cause heart diseases, stroke, diabetes, and some others, cancer. Moving on to the next slide, causes of malnutrition. There are various causes of malnutrition, but the most important one is the nutrition deficiency due to poverty, lack of education about nutrition and other social factors, and also the medical conditions and issues related to the nutrition observations such as Crohn's disease and celiac disease. Malnutrition in Nepal. So here I'm going to discuss about the status of malnutrition in Nepal. Malnutrition is very common in maternal and infant in Nepal, and there are some root causes behind it, including poverty, political instability and other environmental factors. And the secondary factors can be described as lack of balanced diet, poor healthcare systems and lack of awareness. Essential nutrient supplements in the mother below 18 years lead to the undernourishment in infant as well. And there are some of the traditional called traditional beliefs that women should can bear more children. They are compelled to bear more than 4 children, and which worse their already terrible situation because of the malnutrition. So next two decades after 2090, Nepal took remarkable measures to reduce malnutrition among children and women. After the legislature and international agency made or moved in the late decades to hold the stunning insights that took actions that showed that half of the under 5 mortality in the country was due to the malnutrition. So despite of their the measures they took, figure for stunning, wasting and anemia in Nepal, it increased. And according to the UNICEF State of the World Children 2019, released in October 2000, reported that 43% of the child under 5 in Nepal were malnourished. Malnutrition in Australia. Malnutrition is not restricted to developing nations. It is surprisingly common hassle in hospital environment in developed countries, including the USA, Australia, and Europe, with prevalence rate between 20 and 50%. The Australian Nutrition Care surveyed completed in 2010 identified 30% of hospitalized patients being critically malnourished. So, malnutrition in Australia is a chief public health problems and it is also known as the silent epidemic. It is estimated to affect 35 to 43% of the patients in Australian hospitals. However, a latest Australian study observed the prevalence rate of malnutrition across 8 residential aged care facilities ranged from 32 to 72%. The most of at the risks of malnutrition in Australia are aged people having eating disorder, people with lack of appetite, and people with medical conditions such as cancer, HIV, or kidney failure. So it can be concluded that malnutrition impacts mostly on maternal and the child health in Nepal, whereas elderly and bedridden patients are more prone to malnutrition in Australia. The rate of prevalence of malnutrition in this country varies because of the many factors, for example, healthcare system, aged care facilities, and other nursing home to care for elderly people exist in Nepal in Australia. However, there are cultural factors to care for the elderly parents at home in Nepal. So, malnutrition can put various impact on the healthcare system. So, malnutrition puts extra weight on healthcare system as malnourished patients frequently have higher rate of infection. They are very prone to the infection, high rate of contamination. They are very prone to the communicable diseases which requires more medical attention. All these joint issues increased medical cost relating with the treatment of the patient. So it is impacting healthcare system in the same way in the both of the countries. Moving on to the next slide, we have got factors impacting health issues. So, talking about Nepal, it is a developing country. It has three geographical regions: the mountain, the hilly, and the Tarai region. Tall mountain, including the highest peak of the world, the Mount Everest, lie in these mountain regions. And because of its geographic features, development process is very slow. Therefore, most of the rural Nepal is located on hilly in the mountain region, making the healthcare facilities, transportation facilities unaccessible. So, in order to get basic healthcare system, people have to walk miles of distance, which may result in a delay of the treatment, which may be unfavorable to the patient in the need of immediate medical attention. Furthermore, the country's geographical and the sociological variety consequences in the periodic epidemic and other natural disasters like flood, landslide, fires, which can impact on the health as well. So people in the rural area are prone to the infection and other communicable diseases, including malnutrition. There are more healthcare centers in urban area as compared to the rural area. Uh, Whereas talking about Australia, it is advanced. It is the one of the most developed countries in the world, not only compared to Australia but Nepal, but also compared to other nations of the world. So Australia has an advanced healthcare system. Every states and territories have enough hospitals, and there is no any difficulty of accessing the health facilities. Transportation is there, health services, and everything is there. So in nutshell, we can say that the healthcare system is more advanced and accessible in Australia as compared to Nepal. So it is a complex geographical structure making the accessibility complicated in Nepal. Moving on to the next slide, I've got statistic comparison and roles of nurses. So like Australia, registered nurse exist in Nepal as well. The students should complete either 3 years of proficiency certificate level PCL or 4 years of Bachelor of Nursing in Science, and must appear the license exam to register in Nepal Nursing Council, and work as a registered nurse. So it is basically same as Australia. Here we have got APRA, but in Nepal it is the Nepal Nursing Council taking the responsibility of registration and everything for the nurse. So yeah, and then roles and responsibility of the nurse of Nepal in Australia is similar. which includes care providing, communicating, conducting research, supervising, and they can and the fields of working also is also same. In community hospital settings, in schools, and in other areas. So mm, so, according to the Nursing Council of Nepal, by the end of the September 2016, there are 30,379 staff nurses, 818 foreign nurses are registered, and the nurse to patient ratio is 11 to 11 per 10,000 population, which is very huge, not good. Whereas in 2015, the total number of the midwives Total of the nurses and midwives registered in Australia was 360,008. It was according to the Nursing and Midwifery Workforce 2015. But in Australia, the nurse to patient ratio varies from healthcare facilities, state and territories. The nurse to patient ratio is one nurse to every three patient, one in charge nurse and two other enrolled nurse, according to the Australian Nursing and Midwifery Federation in 2015. So we can see that Australia is Australia have higher number of nurses, whereas Nepal doesn't. So, because of the large amount of nurses, Australians are receiving quality nursing care, resulting in less mortality and morbidity rate compared to Nepal. So, at last, we can conclude that malnutrition is a global health problem. In fact, in maternal health is mostly affected by the malnutrition in Nepal. Hospitalized and elderly patients are prone to malnutrition in Australia, and Australia is more and more facilitated than Nepal in the healthcare sectors. So these are my references. If you have any questions, you can just comment me on the discussion board. And thank you so much.